So most of us want to augment the cheek to create a shadow effect underneath the malar area like this, exactly where we would put bronzer on. She has a nice shadow, a natural effect, lateral to the cheek, the front of the cheek, the apple of the cheek. What we need to replace where she's lost her shadow is right in the front here. Now you never want to put filler too close to the corners of the nose. We don't want to create a shadow in the nasolabial fold. We generally correct those. But if we just add a little bit of filler here, we'll create a nice contoured area right under where my finger is there. It'll also raise the cheek right in this spot, elevating the skin under the eye to hopefully create some tear trough correction as well.
Well, what creates those little spots that you're needing to plump back up with that filler?
We have 2 fat pads and 2 muscle pads here. They used to be nice and plump and connected and full, and as we age they shrink and separate, and that creates an elongated tear trough look where the tear trough just looks like it starts to cut through the cheek. As those separate and shrink, you get a little bit of hollowness right in here, and you can see that on Beth. If we turn you this way, there's just a little bit of a dip here, and on this side here. On this side, no one is symmetrical. That goes for your nerves, your bones, your fat, your muscle. Nothing is symmetrical in the body. And on her, you can see that she's higher right under the eye on this side, and lower right here, and on the apple of the cheek. She doesn't have as much fullness there as she does right in here and here. So placement's going to be different on each side, which means swelling is going to be a little bit of different. But swelling and bruising is just generally not really too bad in the cheek area. If you bruise, it's minimal.
So last time I remember you had said we could continue some filler out a little more laterally. So what does that do?
If we pulled you up this way, we just get a little bit more of a contour in that area. We do want to be careful that we don't, you are tiny, so we don't want to create huge cheeks and make them look unnatural, but we can certainly add a little bit of a more dramatic effect in here for sure. That'll look really pretty.
And to minimize any chances of excessive bruising or swelling, what does Beth need to do before? What was her protocol beforehand?
We like to refrain from aspirin and ibuprofen, as well as fish oil, vitamins. Those are probably the 3 main things that'll thin your blood out before an injection to help prevent any bruising or swelling. Unfortunately, in the cheeks, it's impossible to see the veins, but if you know your anatomy, you know in the general area where those major veins are, and we hope to avoid them. Different clinics have different protocols as far as how long you should be off of them. We ask 14 days. We don't always get 14 days, but the longer the better.
Are you excited?
Yes.
I am too. This is going to be amazing.
I have lost my OG curve.
That's right. We need that S curve back. Today we're going to use Lift, formerly known as Perlane, which is an excellent product for you. Now I'm going to start in the apple of the cheek and really just put enough to where it's exactly how I would want it to be later. As I'm injecting, I'm going to watch what it does under the eye and then go from there. It's important that you go all the way down and then lift a little.
And since our faces aren't symmetrical, you really are an artist, having to place it. You can't just go on the right cheek,
Right.
on the left cheek.
That's true. I generally go for hollowness and shadows and replace lost volume first. So we'll do that on this cheek, and then we'll do that on this cheek. By the time we come back to start working on symmetry on both cheeks, they should be good and numb. So Sorry.
That's exciting.
You can really see the filler project as you inject, which makes it a very easy treatment to eyeball. There's really no guessing. What you see is what you get with this treatment. It's also important that you do very little massaging. You just want to put it exactly where you want it to stay, and instruct the patient to not sleep on her face for a few days. We don't want to flatten that product.
Now, I know Beth is a big yoga person. What about people who like to work out? What do you advise for them for post-treatment care?
I generally say that you could, for the most part, resume your normal activities. If for whatever reason you wake up and you see some bruising and you really need that bruising to go away sooner than later, then I would take it easy a little bit and not overdo it. So the apple of the cheek looks nice and full and round. Now we're just going to give her a little bit more of a dramatic effect out here. And these are the areas where you can sometimes get a little bit of bruising because you can't see those veins, but if you see a little bit of blood, more than just when the needle goes through the skin, you think you've nicked a little vessel, you just put a little pressure.
You can hear the filler going in a little bit. It sounds kind of like crunchy. How would you say it?
Some of that, mostly lidocaine. There's lidocaine mixed in with the filler. And
On a scale from 1 to 10, Beth, how uncomfortable are you?
I mean, the only thing I can really feel is I can feel pressure, and I can feel, I guess, a little bit when the needle pierces the skin. But I mean, a 1, it really, I don't think it's painful at all.
You're not having panic attacks on the...
No.
That's good.
So how do you choose how much filler you're going to use with each person? Like, what would be an average amount?
when someone young like you and doesn't have a lot of volume loss, you don't want to put too much. It takes very little when your skin is already nice and tight. On older patients that have a lot of lax tissue, they are going to need a lot more to smooth the skin out. So it just depends. So far we've only used 0.3 out of a whole syringe. Just nothing. Let me close your eyes.
How much swelling do you get from a cheek enhancement?
There's really not a lot of swelling, I find. Most people love the swelling.
Like after a lip enhancement?
Right.
So tear troughs would be a different story, though, right? You always advise them that they're going to look like for about 3 or 4 days, a bad allergy attack. This one they can resume normal activity.
Oh yeah, absolutely. Cheeks are no big deal.
And is Lift only intended for cheeks?
Lift is only FDA approved for cheeks.
Got it.
But we use it in all sorts of things.
Which is typical.
Yes.
Professionally trained.
Yes.
So I know we have people come back in for follow-ups often for, lips. They just want, a little bit extra somewhere or, a little bit of extra Botox somewhere. Do people generally do touch-ups for cheeks? Or are they kind of just done after the first appointment?
I feel like cheeks are one of the easiest areas for an injector. It's not typical that it is performed in a series of treatments or it's not necessary. Most people repeat or touch up at about 1 year when they've lost about half of their product or metabolized it. It's indicated for 2 years.
So it's been about a year for me. So you think I still have some product in there?
Do you?
I mean, I can still see the curve a little bit, when I look at myself from an angle. But I definitely notice a difference after a year of, obviously I wanted to do it again.
Right.
The flattening feels more like, it seems more like here is kind of how I see it in the mirror. Is what it looks like to me, like a sagging almost.
Right. You're seeing it here.
Yeah.
Yeah.
So why is that? Why do you see it here when the product goes higher?
Well, you're still seeing the correction. You're still seeing that your cheeks are still fuller, right? But your focus is starting to go here because that's where you get shadows, and you can almost do a test with the cheeks. A pinch test is what I call it, to see exactly where it's going to pull from.
Okay.
There's not a whole lot of shadowing going on here for me to demonstrate in the video, but on someone who has a downturn oral commissure or marionette line where there's a distinct shadow, you can just lift this and it'll disappear.
With cheeks, and I know it helps to plump that OG curve that we have, but can it also assist with other areas of the face for a small bit of correction, say like tear troughs or jowls, nasolabial folds?
It certainly can. Our intention today is to evaluate the tear trough as we're treating her cheek. We may possibly need a little bit of filler in the far upper, right under the tear duct in this area. But if you can see in the video how much correction she's already got on this side versus this side, just from doing the cheeks alone. So in my opinion, it's better to do as little filler under the eyes and more in the cheek to give that kind of correction. You can also get correction around the mouth. Generally, wherever the hollows are, wherever the fat loss is in the cheek area, is exactly where it's going to fall and create a shadow around the mouth. You can almost do what I call a pinch test, where, and it's hard to see on her if she doesn't have a whole lot going on, but if she had a marionette or a downturned smile at the corner of the mouth, you could pinch this area right in here and it would disappear. And that's exactly where we would be putting filler. On her cheek on this side, she is more hollow right under the eye here. So we're going to do more work in the apple of the cheek on her on this side, whereas we did more in the malar of the cheek here.
There's that asymmetry again, huh? That's interesting.
And it's also on the left side, right? The driving side.
Right.
More sun damage.
More lax tissue.
Please wear sunscreen.
Yes.
That is amazing.
Does it look good?
Yeah, it looks great.
Good.
And you don't look like Lady Gaga from the VMAs.
Right.
I get that question a lot. Am I going to look like an alien? No.
So far on her, we haven't even used a whole syringe. She just needs tweaking, just a little
Because
bit
she's in
here and
maintenance
there.
mode, right?
Exactly.
So if she would have waited the whole 2 years, let's just say she wasn't able to come back in a year, depending on her metabolism, lifestyle, things like that, she may need to start back at baseline, but because she's coming in at that year, it's just a little maintenance, correct?
That's correct. How many syringes did we do
1.5.
a year ago?
Okay.
Yeah.
And you're not even through a full one yet.
Right.
That is so great. Stop it before it starts.
That's right. Nice, beautiful contours. Does it feel nice and numb yet?
Yeah,
Getting
pretty
there.
much. I mean, it just feels dull.
Yeah.
Oh, because the product has lidocaine in it. Is that right?
Mhm.
Okay.
I'm gonna lift your head up a little and chin down just a smidge. Just gonna, so this cheek is a little bit higher. We're gonna now just raise this one just a smidge.
So are you massaging the product when you're doing that? Or are you just feeling for something?
Just feeling you up.
Sorry.
That's my thing. That's what I say these days. What we don't want to end up with are walnuts later. I see that all the time. Patients come in and they've got 1, 2, 3 big bumps. And so I'm basically just feeling and making sure that they're nice and connected and
Mm-hmm.
the transition from the apple of the cheek up. Just perfectly smooth. And as you can tell, possibly, I'm not sure how numb you are, but I'm bringing very little pressure on it. Just looking for those little irregularities.
Now, does she need to do any work at home? Does she have any
Not at
homework?
all.
Perfect.
Stay off your cheeks. Don't lay on them.
So Maricela asked about exercise earlier, and I do yoga, so that's a little bit different because you're upside down a lot. So do you still say the same amount of time as regular exercise as doing something where you're going to be upside down a lot?
With the cheeks, you really can do your yoga.
Okay.
Yeah, I wouldn't worry about not exercising.
Just
Okay.
don't face plant.
Just don't face plant.
Be really good at
I
that
don't do that
pose.
anymore.
Be really good at that pose. Teardrops.
I think we get the most questions about tear troughs. I think people are afraid of tear troughs. What do you think, Maricela?
Oh, all the time. I feel that if they're prepared properly with their pre-care instructions, their post-care, making sure that they're not doing it 2 days before a big event or about before vacation. Because you want to relax on vacation, not watch a bruise heal
Right.
or watch swelling go down.
And I think people are just concerned because it's around their eye. You know, I think they have a hard time wrapping their head around how it's going to work.
Well, there are more problems in this area reported and talked about online, and than any other area, so it's
I always get how long you've been injecting. Well, I get that question a lot, but tear troughs. How long have you been injecting in the tear trough area?
tear trough area since I've been doing tear troughs for 5 years,
That's a lot of tear troughs.
Mm-hmm.
and I do a lot of them
Mm-hmm.
every day.
You know what else I've seen is you do corrective work.
Mm-hmm.
People will come in from a different establishment. And those turn out great.
First praise of the day.
You're welcome, Beth.
You're welcome.
So I wanted to do my tear troughs because I have dark circles under my eyes, and I always have. And this is just like a miraculous procedure for that, I think. But what are other reasons people do it? I know you can correct like puffiness.
Yeah, there are 3 different things that categorize or that can make up a dark under eye circle. One would be puffiness, and that puffiness creates a shadow effect underneath the puff. Another would be discoloration or hyperpigmentation or sun damage, and the other is just that that pink purplish hue that we all seem to have. You're just looking at your muscle through your skin. It's just the skin is so thin there. Some people have all 3.
That's right, because you're going to edit out.
We're under the eye today. We're not using a micro cannula. We're just somewhat traditional technique that Beth prefers, and because we've already done the cheek, it would be a little harder to get the cannula in, and that's why she breathes.
Are under eyes genetic?
Yes,
Yeah.
everything.
So you can look at your mom and say, those are what my cheeks gonna look like.
That's right.
That's what my under eyes are gonna look like.
Do you usually use a cannula, or is it like, do you decide based on thin skin or what?
Right. Yeah. Your skin is pretty thin, and you don't have a lot of fat on your face, so it's not a bad idea. The way that we're doing it today is perfect. I can really manipulate where I'm putting it, as opposed to just going in and throwing in a few lines of product.
Throw it in there. Hold still, Beth. Come into my needle.
And this area is like one of the most likely to bruise. Is that correct?
Yes,
Yeah,
absolutely.
it's just vascular.
I tell people just go ahead and expect the bruise. If you don't, then we're happy that you didn't. But we'll just go ahead and count on it. Your social schedule should count on it. Just be prepared.
Did we already say what product we're using?
Oh, this is regular Restylane. Good old-fashioned Restylane. One of the first HA on the market.
Thanks, Galderma.
Yeah.
That also counts towards your Aspire points. For those who have questions, come and ask Maricela up at the front. Or don't.
This just looks amazing.
This is my artistic shot right here.
So one of the reasons that I wanted to do this video is, well, one, just so people can see obviously what these procedures are like while you're having them done, but also so that you can see what you can do with multiple syringes. I think sometimes people think, 2 or 3 syringes is like, what am I going to do with that? I'm going to look crazy. And with our open house coming up, we do have multiple syringe specials. So I think it's just important for people to see where that product goes and what it looks like when it's properly placed.
And how fast it goes.
Yeah,
You know?
true.
Iris, what are you doing?
I am making sure that this product is super smooth, even though it is very deep. The reason we put it deep in this area is so that we don't see the product poking out of the skin,
Mm-hmm.
and so that we don't get any tingling or bluish effect under the eye. This technique was what we call tiny boluses of product, or like little tiny balls of product on the bone along the trough. Now I'm just connecting the dots.
Oh.
I'm also holding the skin. I mean, that's how thin the skin is. I can just almost see through it
Mm-hmm.
to see if there are any visible boluses. So I don't want any lumps or bumps later.
Kind of diffuse.
Filler is malleable in every area, but under the eyes I find it to be very malleable and for a longer period of time. So even when you're icing, and especially be careful while you're numb and you're icing because you won't really know your pressure.
Mm-hmm.